Yeah, we're ready.
All right. Here live at Crooked Spine Show. We're at Cedar House in Bloomington. Here with Jamie, a big Steeler fan like myself, and also Mike. Steeler fan? No, obviously not.
Rams, Raiders.
Sorry about that, Mike.
That's okay.
Sorry about that.
Good next show.
I mean, try to stay at home.
Good for you. Good for you. Makes it easier to watch TV, I guess. We're going to talk about, what are we going to talk about today?
We're going to talk about changing people's lives.
Okay. And this is more, from what I've read again, short-term and getting into long-term care for drug rehab, mental illness. What else?
I think that pretty much that covers it.
The 90% rule, okay, of that.
Sure.
And when we talked about to start, how long ago? When did Cedar House really start as a corporation, as an organization?
Cedar House incorporated in 1973. Started off as a 12-bed facility, primarily to treat men with alcoholism issues. Since that time, we've graduated to a multi-facility, 143 beds.
Wow.
And encompasses quite a continuum of care, including outpatient treatment, detox, residential, long-term, 30, 60, 90 days, actually, short-term. And then we also have a facility very close and nearby here that houses women with children.
Okay.
Also treatment, 30, 60, 90 days. Could be a little longer depending because we're dealing with a whole different element. Yeah. And then also we have 2 housing units. We have a sober living unit across the street for adult men. Okay. And then up in Apple Valley, in our most recent addition is a housing unit for transitional aged youth. Okay. And it's located in the high desert, has a capacity of up to 32. We noticed that we had a lot of young people coming through treatment.
Young meaning like teenagers, 10, 12?
No, we're all adults, so 18 and up.
18
right,
okay.
18 and up. But when I say young, I'm talking son's age, 18 to 25. And so a lot of times they would come to us and they had nowhere to go whenever they were getting ready to leave and no family support.
Wow.
So when the opportunity came, we decided to embark on that process, and so now we have a transitional housing unit for that specific age population.
So there's basically 4 different buildings or facilities, correct?
Correct.
Okay.
Yeah.
Okay.
Correct.
And right now here, what do you focus on at this facility?
This particular facility is primarily focused on substance abuse treatment and co-occurring disorders.
Okay.
So, and I'll let Mike speak to this going for a little more detail, but Cedar House has kind of its expertise and known specialty is in working with individuals that have co-occurring disorders.
What is that?
Essentially what that is they have a substance abuse issue, but concurrent, they're dealing with mental health issues. A lot of times what we find when we get people into treatment who are addicted to a street drug is that because they lacked the resources for proper care before they came in, they were self-medicating what was a mental health diagnosis that was left undiagnosed, untreated. And so now we're dealing with that element as well. And so we will work with a lot of people that may struggle in other treatment facilities, but they know they can come here. My staff are extremely tolerant and work very well with that population in particular.
And walk me through how their process goes when they come in. Do you see a medical doctor first? Do you see a therapist? Do they get drug tested, or how does that work?
Well, that depends.
Yeah, well, because of our Medi-Cal waiver that we have to adhere to, they have to get screened by the county's assessment centers first.
Okay.
Once they're assessed, then they're channeled here or other facilities, and then yes, they're assessed by the medical staff and to determine what kind of medical problems or mental health problems that they've been diagnosed with. If they have proper medication to be able to do program here, the doctor has to make that clear way for them to do a program here.
Okay.
Then we determine whether or not they're going to need withdrawal management, which is detox. And the doctor's going to prescribe a medication protocol for them to do withdrawal management, and or not, and they're just going to come in the program, and they're going to be further assessed throughout the whole treatment episode.
So, Mike, if someone comes in then, like Jamie was saying, they may be on a street drug, but they have mental issue. Now they've been diagnosed for whatever's going on. At that point, like you'd mentioned, they actually may go on some medications to get them off the street drug, then get into more. They can detox completely, so it kind of weans them down a little bit.
Yes, we don't know which came first.
Sure.
And when Jamie mentioned earlier about youth, a lot of the people nowadays, I would say over the last 10 years, a lot of kids have come to us. But they have to be 18 years old to get in here.
Yes.
But they may have been using for 8 years already.
Wow.
They may have gone undiagnosed for 8 years, or they may have a diagnosis and not have been medication compliant. So that's what we're dealing with. So for us, we're not here to determine which came first.
Yes.
But we do know it's self-medication. And so we have to find out their history and see if we can find out who their doctors are, or refer them to the proper mental health facilities to get an assessment for medication. And we do have to help them understand that it's quite possible that you've been using maybe an illicit substance.
Yes.
To maintain your lifestyle. To maintain a certain lifestyle, and then that lifestyle, which is unhealthy, helps encourage you to go keep using that illicit substance.
It's a feedback loop.
Yeah, we're trying to get them to look at that for a second here, and just to see how it would be if you had prescribed medications. And so it's traumatic. It's traumatic to have done something for so many years and have it taken away from you, even though it's killing you.
That was our truth for the last maybe 6 months, a year, 5 years, 8 years. So this is how do I change my whole mentality of how I'm healthy versus what health is.
Right, and that's why we're here. We don't just want them to look at you need to stop using substances. We want you to have a new perspective of self. There's some value there, and we just need you to be open-minded enough just to take a moment to look at who you are without these unhealthy behaviors, lifestyle, substances that you take in, and just see if you like what you see.
So their perception, they have to be open to a different perception of their life at that point. Is there a certain extremes to where at that point they can't see until they've detoxed a little bit here or there, or done medications, or how does the extremes kind of work on that end? What blocks them from seeing that? What's a common thing?
Well, one of the common denominators is the lifestyle that they lived for so long, or the way when they live a certain way for so long, we believe that some of those things were there before they became addicts. They've maybe been traumatized, or there's something unhealthy going on before they became addicts.
There was a trigger.
So we traumatize them by saying, okay, you're clean, stop using now.
Yeah.
And then they still have these tools that they manage life with that are extremely unhealthy, and we're asking them to rid themselves of that as well. Well, the substance use can stop that, and which is traumatic, but it can stop, and they realize, I really don't need that. But how do I live from age 8 years old? Now I'm 18 or 21 years old. How do I live now? Because my whole teenage and adult life so far has been under the influence and living an unhealthy lifestyle, and that's how I manage life. And when life gets tough, I use.
I go back.
Yeah. So now life hits me.
Yeah.
So and they call it post-acute withdrawal syndrome, which is a series of symptoms that occur when you become clean and sober. Often can last up to 18 months.
Wow. Okay.
So here's the thing: those symptoms are things such as irritability, intolerance, oversensitive, over emotional,
Depression.
insensitive. I mean, those things. Yeah, even the bipolar, the stuff like that. Those things are things that happen because now life is hitting you head on without any substance use.
When they've had no way to learn from 8 to 18 how to deal with it in a natural, younger environment, a safe environment.
Yes.
A school setting, for example, or playing with kids where they have an argument and they figure it out and they're good again.
Yeah.
They either learn that unconsciously or consciously, I'm assuming.
Yeah, something they may have never been in a healthy environment ever.
Yeah.
And so they have tools to manage the unhealthy environment and no tools to manage a healthy environment. That's why they struggle. So when you ask me, what's the what keeps them from what's the point of where it's the most extreme struggle, that is when they get sober and they're at Cedar House, it's a unconditionally loving environment. Like there's no condition on which we don't love you and take care of you. Even if you're acting up, we still love you.
Yeah.
And
they do
it's
act
difficult for them. That is difficult for them.
They've never seen that before.
They've never seen it before, and they don't know how to handle it. So they have these tools that burden them because they're trying to use these tools when the environment which made them necessary no longer exists.
And and it's not just the youth that go through that. And one of the analogies that I like to use for people that maybe are trying to grasp this whole thing about drug addiction and why can't you just stop, and you see it's killing you, you see it's wrecking your family, you see you can't hold a job, you see it just impacts every area of your life. But imagine this, Tony, you're in the middle of a raging river and you've got your arms around this rock that's in the middle of this river, and the water's just beating you from every side, even beating your head against the rock from time to time. And you know that the only way you're ever going to survive is to let go of this rock and let that water take you to the water's edge. That's a scary proposition.
Is it or you've been told it's you can get to the water's edge?
You've been told because you see a whole bunch of people standing over there on the water's edge.
Okay.
But yet, for you to let go of that rock, it's terrifying. And so, helping them understand that, once you get to the water's edge, there are tools, there is hope, there is life, there is all kinds of things waiting for you. There is happiness, there's family, there's job, there's, all kinds of things. That if you'll just let go of that rock and you'll brave that rough water for a short period of time, life can be beautiful. And that's kind of what I think we're trying to help people get to that place.
That's a good way to put it, Jamie. Tony, it's misery.
You have to get
But
through that.
but just like that rock and the water, they're comfortable in that misery. Only
least
because
I know I
they
can
know how to
breathe.
manage that. They have the tools to manage
That's their
that.
normal.
That's it.
So it's chaotic, whatever it is. So again, they become dependent on that. That's just it. And they have to be opened up to see that there just might be another way to live than the way you've been living,
Yeah.
And it's just like when you asked her that question about, but they were told that, the water's down the road, there's something positive down there. Yes, they're told that, and they have to be shown that. And a lot of them just don't think there's another way to live, and you just have to show them. And so it's really good to have people down the road, and we bring in the people at meetings at night. They do 12-step meetings. They've been down the road, they've been down that same road, and they give them strength and hope, with their testimonies.
They show them it can be done.
That it can be done,
And a majority of our staff are recovering.
Yes.
They've gone through the program.
They've gone
Yes.
through either this or another program.
Yes.
We do have a number of Cedar House graduates that come back to work here.
Yeah.
Okay. Okay. And with that going on, as people get older, you said from, say, 18 years old to maybe 25, 35, 45, is it harder or easier to let go of that rock when you get older?
I would say that it's case
so
by
many
case.
variables. Yeah, so many variables.
It's case
right?
by case.
Okay.
Because as you get older, I mean, if you just take men for instance, if you get older, what they think is that they become more macho, more man,
Yeah.
or they have to be.
Pride.
Because their perspective of what a man is skewed, in other words, like independence and self-centeredness, like I don't need any help, even though I'm in trouble, I don't need help, I'm a man, And so when you get older and you put up those walls and those walls are strengthened, yes, that in that sense it gets more difficult as they get older. You can't tell them what to do. Once they get clean and sober, and now there's a lifestyle that you have to deal with. It's harder for them to let go.
Okay.
But also with age, people get tired.
So that's the other side.
Sick
Okay.
and tired.
Yeah, that's the
Sick and
humility
tired.
part of it. When they get tired and you're like, okay, I'm ready to listen. So it's case by case, and you just got to open them up.
Get worn down a little bit.
Yeah.
I think too, the other element, as for any of us in any situation that we've got to get through a difficult situation, is that what's on the other side of that for us.
Yeah.
So for example, we have a contract with the county Children and Family Services. And so a number of people who come here are here because somebody else has custody of my kids because I'm a drug addict.
There's
And
a
I
carrot
think
out there.
There's
Okay.
a big carrot compared to somebody that has nothing really to look forward to. So, you want to kind of, try to as well is give people as many carrots as are real in their life. And,
Know the situation, know what's going on.
Continue to, kind of give them, this is why you want to fight through this. This is why you want to do this.
Wow. Okay. And is once they've gotten and they go, okay, I'm done. I'm gonna let go of this rock. I'm gonna let this process happen. Then what? Then what happens?
They make that same decision every day. Sometimes they make it every 5 minutes because it's one of those kinds of things that, that's what, I felt. And I was in the mood to say when I said it, I really meant it. Mm-hmm. But today, now that I'm confronted with, being ticked off at this staff person or having a phone call with my mother that just went sour or whatever life brings, as life does for all of us, now all of a sudden, so they sometimes have to make that decision multiple times.
That change. And when they do that, what type of tools do you have there or here to help them, I guess, transition? Is it more group therapy? Is it more keeping a diary? What do you have them do? What kind of tools you offer?
All kinds
I don't know. That's what
we have
about.
We have evidence-based curriculum.
Okay.
What I would tell you about it is that all of it is about honest self-assessment.
Okay.
We try to encourage them when they're reading the literature and answering the questions that you're not trying to get a grade. Right. You're trying to assess yourself through.
It's not about me accepting you. It's about you accepting yourself.
Yes, and then the next thing is a spiritual foundation. Right. And the recovery community preaches that you need to be humble enough to understand that there is a power greater than yourself. I'm sure you've heard that before.
Yes.
Some of them have had a faith in a God and have lost their way. Some of them don't really know what that is.
Yeah.
So we have to let them know that you're not the end of the world. You're not the world. The world doesn't revolve around you. There is a power greater than yourself, and we have to show them that. And we try to encourage them in any kind of way. If there are 10 people that are further down the road where you're trying to go, and perhaps maybe the wisdom of those 10 people collectively is just greater than yours when you're trying to go down the same road that they've been down, can you humble yourself to submit to their wisdom? Just for an example, if you can't submit to the wisdom of a God, or
at least take one step toward that. Here's another human.
Yes.
They've gone through what you went through. They got through that. Can you accept that? And then can you understand how they got through there? And then use those tools.
So it's very, very
to
spiritual.
just mimic, per se.
Yes, very spiritual. And it is something that gets lost along the way because people begin to have success, and begin to the hygiene improves, and
yeah.
the grooming improves.
Like, what is this? Who am I?
The family support comes back a little bit. They start, the material things start coming. The job.
They can actually see positivity in their life.
But they have to remain humble because they take that on as, look what I did, and forget that, no, I had help, and I wasn't the higher power at the time. And so they have to constantly be reminded, and they have to remind themselves, stay humble. You didn't do this by yourself. Even if it was a job, someone had to give it to you. Apartment, someone had to let you in. Whatever it is.
Right.
So what was important is the relationships that you had with those people, not necessarily the accomplishments that you made.
So it's being grateful as much as humble.
Absolutely.
Great. No, gratitude is huge. And as I'm listening to us talk about this, it's no different for any of us.
No, it doesn't matter if you're
I mean, you see a turtle on a fence post, he didn't get there by himself, right? And so we all have to live like that, but it just seems to be
being a human. It's almost you're usually, when you're healthy, in survival mode. You have to think outside the box. Okay, I'm going to read this, do this, talk to these people belonging to this group to help me realize, or go to church, help me realize I need to be grateful, humble. I'm this little ant on this planet for this short window of my life.
Right.
Yes.
I have control over this. The world is 20,000 times bigger than me.
Right.
Yes.
All I have is this.
Yeah.
At that point, some people don't realize that. And I would think, and that's a healthier state. When you're in a stress state, as people I'm assuming here are, they have to close their world out to defend themselves from a human mindset, from a fight or flight mindset.
Yeah. And Jamie brings up an excellent point. Yeah. We have to, our job is to align with our participants and let them know, hey, I live like this too. Whether I'm a recovering addict or not, I have to live by this code as well.
We're all recovering from something.
I have to live by this code as well.
Right.
I might have a diagnosis, or I might be undiagnosed. But I have to live by this code. I live like this. So when I'm telling you, I live the same way.
Even outside of here, my life still deals with the same stressors.
Forever.
Yeah. Good. Absolutely. That means you're still alive if it's
exactly.
you have stress in your life, right?
Yeah.
And I think people, and like you're saying, is when they come in here, they see that and they get that job, they get family connected with, they get that positivity. What makes them draw back? How do they lose their way again?
I would say, and it could be subconscious, but it is arrogance.
Okay.
I can make it softer, by say that their level of humility is diminished because of the accomplishment. Right. Jamie just mentioned self-sabotage.
Self-sabotage.
The thing about it is the fear of success because of the fear of failure.
You've never been there before.
Never been there before, and when I talk to you about being dependent and addicted, well, there's such a thing as being dependent on being dependent. Like I'm going to lose mom's help. I'm going to lose my sister coming and bringing me things, and I'm going to lose all of that if I become independent. Yeah. So it's addiction.
It's almost like people that are incarcerated for long periods of time, and they become very institutionalized in terms of their thinking, and they get released, and now I'm out here in this big bad world, and I really don't know how to operate out here, so let me do something to get back into that cocoon of institutionalization that I'm accustomed to, and that I know how to live in that environment. That's a whole nother world. I know how to live in. Whereas you and I, we go, I wouldn't survive a day in that environment. There are other people that's their comfort zone.
That's their opposite. They're
exactly. And so, especially for folks that come in, because we see people come in, this is their first treatment experience, and I've met people that have, to some degree, even brag, this is my 7th treatment center, and I'm just like, okay, that's okay. I'm glad you're here. I'm really glad that you're here. Let's try to make this one stick. It's okay. And we're, like Mike said, very forgiving, very loving. There is nothing you can do here that my staff don't understand. The expectation is, no, I know you get upset. I know they get on your last nerve sometimes. But you have to always treat them with dignity and respect, because a misstep or an incident with a staff person who they're looking to, whether they know they are or not, or whether they present like, I'm hoping you'll help me right now, they're looking to the staff that are out there day to day to help me get through this bad moment. And if a staff responds in a way that doesn't demonstrate that, that could be the thing that they say,
Absolutely.
I'm done, I'm out of here. And they walk, because this is totally voluntary. Nobody's locked in here. And they could go out there, and that could be the last time anybody ever sees them alive.
That's true.
And so it's very, very important, you know, and we're working on this more and more every day.
You guys are
with the
still
staff.
humans, right?
Yeah, we're still
and
it's difficult. They
know how to press your buttons.
They expect perfection, though.
Yeah, they
you know,
do.
and we understand that, and we have to. It's a difficult.
Yeah.
You know, our when you talk about relapse and some of the causes, the other part of it is from a cultural standpoint. Well, we talk about arrested development, like 10 years old, whatever. Then when I'm 18 years old, I'm way behind, right?
Or I'm 35 and I'm acting like I'm 14 because I've been using drugs since I was 14.
So what do I really have when I get clean and sober? I have this maturation process that's been hindered, and so I'm behind. So what could I do? I could go buy a car. I can get an apartment. I can have these material things, you know. And some of that is it brings pressure on the person that's recovering. They think those things are the main things that are.
The expectation is there.
Yeah,
Okay.
and that's what I was telling you earlier, that you know, they forget, and they put those on the pedestal when the relationships that they have, you know, with their higher power and the other loving relationship, they forget how important those are, because they want to show everybody that, hey, I'm doing well, and so those things become more of a priority. The job, all that kind of.
I have this.
Yeah,
I do this.
Yeah, you know, and so you can imagine someone older. If you're talking about relapse, sometimes someone older, you know, they're 30, 40 years old. They think, I should have this. I should be at this point.
Further
And so
along
they're
in life.
in a hurry to catch up, and we
Yeah.
have to tell them it's okay.
Slow down.
It's okay to be you, and where you are right now. It is completely okay. We love you. You know, and you know, it's just a difficult. It's a lifelong process that they're going to have to practice that level of humility.
And by having that expectation, I need these relationships to work first. Then I can get over here when I'm getting ready, when I'm not allowed to, but when it happens, versus forcing it to happen.
Right.
Because I assume if you force it to happen, that's a stressor, and you go way back over here.
Yes.
It's amazing
Yeah.
how that works.
Yeah.
How does the training for the staff here go? You mentioned the Christian, call it Christianity, but also the grace and the trust and the respect. I mean, that's being a health professional. How do you train the employees and staff here to go through that and understand that? Is that just like boom, they're ready to go?
No,
First day.
no, they're not.
None of us are.
No, of course not.
It's
Of
a learning
course not.
process.
So we have varying levels of readiness, if you will, to work in this environment. First of all, because we are Medi-Cal certified.
What does that mean?
Medi-Cal certified means that we've been approved through Medi-Cal to treat clients here and to receive Medi-Cal funding for those clients.
Okay.
It's not the only clients that we receive, but the majority of our clients here, particularly now, do come to us through the county and through Medi-Cal. But Medi-Cal funding requires that if you're going to be what they call in direct service, meaning you're interacting with the clients, that you have to be at the very minimum registered to become a drug and alcohol counselor.
Got it.
That is a maximum 5-year process that you have. From the day you register, you have to have that completed within a 5-year period. And that involves quite a number of things, not the least of which a certain amount of education.
Okay.
So they have to be in school taking very specific coursework regarding substance abuse treatment, so on and so forth, as well as hours not on the job, but servicing these clients. So we have staff that work in what we call our stations. They're called client care specialists. And so they may be, typically what we'll see is people who come in that have absolutely no start at all. They were recovering or are recovering themselves and just know this is a population they want to help. And so they look for a job in this field and they start that process. But, because they are recovering, and there is a minimum period of time in which you have to have demonstrated clean and sober lifestyle before we would even consider bringing you on as a staff.
Okay.
And so they may be at the very beginning of that process. Others have finished their schooling and now they just need to get their hours. And so they come to work at a place like this to get their hours. If you are able to get through all of that, and so part of that training, back to what you were asking, is certainly we have our onboarding process, right? And that involves everything from, you have to take these certain trainings that we make available
Courses,
to you, online. We have an online portal that we send people to for all our webinar type trainings. Plus they follow a staff person for a period of time. And they not only learn their job, but they're also required, we have this process where they have to meet with all of the different department heads because, let's say I work in the station, so all I know is station.
Yes.
But we have all this other stuff that goes on at Cedar House. I want you to at least know about that.
Yep.
And so they meet with all the directors and department heads of all the different things so they see how does my little part play in this big picture. And so so they go through that process, meeting with all the department heads and directors. And then from there, it's pretty much just an ongoing day by day, walking them through the processes, letting them, stumble and fall. And here's the thing, Michael said, our clients expect perfection. There are certain things, Tony, that we can work with you on in terms of behavior.
Yes.
As a staff.
As a staff person,
Okay.
exactly.
Okay, good.
But there has to be this core element, right, that has to exist. That if it doesn't exist, or if you portray some behaviors or something or other that is downright detrimental to our clients, we're not going to work with you on that because I'm not going to run the risk that I'm going to have you out on the floor practicing your craft and subjecting clients to unnecessary stressors. They come here, they're vulnerable, they have a lot at stake, and we need everybody that walks in the door to have a certain amount of professionalism and decorum that no matter where they are in their learning curve and process, that they're able to do at least this common denominator of dignity and respect and kindness. So outside of that, we can pretty much work with staff and train them in pretty much anything.
Yeah. They have to maintain. We have continuing education that the Department of Healthcare Services and Drug Medi-Cal, they mandate that the people that are in direct services with the clients that are registered and certified, they have to maintain a level every year. So they go to trainings. We send people to trainings all the time. And sometimes it's not just for requirement, it's just for edification, that we can get them updated to what's going on, or if there's something new going on, we'll send them and we'll all get trained. She even goes to some of the classes. So, and that's just ongoing. And of course they have to get recertified every 2 years or so.
It's like anyone in healthcare has to do
Absolutely.
that.
And speaking of the requirements to become an alcohol and drug counselor or a registered addictions treatment specialist or whatever, the schools, most of them, it's not just about substance use disorder, as we discussed.
Yes.
I mean, there's
a lot of
psychology
other
classes, there's sociology. It's just human services. It's just all over the place because everybody understands that it's about the addict and not the substance.
Yeah.
And a lot of it is, like you're talking about, is you're going to have, the school training, the online training, the continuing education, but unless you have the personality, the character, and the passion for it, you can get weeded out quick.
Very good. Very good.
Quickly.
Passion
Yeah.
is key.
And compassion is extremely
Yes.
key.
Yeah, we absolutely preach that, and we've studied it. We've studied how much staff engagement helps the client feel comfortable and want them. They want to stay. You know, if they feel like you're really engaged in what's going on with them. You know, and I mean, it's the research shows that that they would stay here longer, and we get a higher completion rate if they we understand that, and these are not my words, that these people don't care how much you know unless they know how much you care.
Yes.
You know, and it's absolutely true with them. They just want to know. It's as simple as they've been traumatized. You know, I had an experience with working with kids with Down syndrome.
Okay.
And they could tell if you were uncomfortable around them. And they would shy away, or they wouldn't want you to give them a hug, or if they knew, you know. And this is a similar situation. These people, they really can sense. They've been out there on the street. They've been living life. They know people, and they can sense whether you're genuine.
They probably have more experience than you.
Absolutely,
on the range of
absolutely.
people are going to help me, people are going to hurt me, people are going to really hurt me.
Right.
So that's it's a similar situation to where the lights go off. They get bright as soon as they see that. Oh, you really care.
Yeah.
And that's what we were talking about when we were talking about unconditional love. Like, there's nothing you can do that will keep us from loving you.
Yeah. I think that experience of being in that environment and being mentored as a staff member, you're going to see them uncomfortable initially. Not something like, oh, it's a safe environment. I can be myself and help these people and not be judged by somebody else what's going on. I'm not going to be told I have to do this, this, and this. Just love them.
Yes.
Just show them that you care.
It'll all come out if you do that.
That's great.
Yeah.
It's amazing, right? But it's something we're not trained that way.
That's not training.
That's not training.
No, that's
not training.
No.
We're
growth
just
and
prayerful and hopeful that you got into this line of work because of that.
because you have that already.
You have that gift already.
Yeah.
You have that caring attitude.
Yeah.
And then we train them in all the paperwork because there's a ton of
Yay,
paperwork.
I love
Yay.
paperwork. No.
Right.
But it keeps the place running.
That's right.
That's why you have to be able, like you said, you have to be able to do the back end, front end, everything, know all the departments, because you may have to do paperwork for someone in this department.
Right.
And if you don't know what they do or who to talk to, you're like, then you're kind of lost.
Yeah.
Yeah.
Or it's not that important.
Yeah.
But in reality, it's very important because it equates to,
That client, that person may need that paperwork filled out to get the next step and get this job over here and
Right.
get clearance for this over here.
Exactly.
Absolutely.
Yeah.
So,
Absolutely.
but by being a caring person, though, you know that's important. You might be tired in the day and in the week, may not be feeling good. I get done for them, not for me.
That's right.
It's amazing.
And we're here for them. They're
Yes.
not here for us.
It's like, it's called work. You
Yeah.
should be tired. You should be a little bit exhausted. That means you did a good job. I think. That's just me. That's just me.
Yeah.
What else do you guys want to talk about today? And talking about the Women and Family program, how does that
Women and
work?
children.
How does that work with children?
So, so the facility is called Maple House.
Okay.
And essentially it has 11 beds for women and room for up to 15 children.
Okay.
So a woman may, being a single mother and needing treatment sometimes can be a real challenge when you have young children that are dependent upon you to care for them, and you really don't have anybody in your family that you would be willing to entrust your children to while you go away to treatment. So it can be a real obstacle for women a lot of times in seeking treatment. And so Maple House was designed for that very purpose. So you can be a mother who is drug addicted and you need help and you want help, but now you've got your young children with you. You can bring them with you. It's a perinatal program, so we treat pregnant women as well as, after the babies are born or if they come with their children. And so they're in a house-like environment. This is a much more hospital-like environment here. This
building.
facility,
Yeah.
right?
Okay.
This building, and so Maple House, however, is a house, and so the women all live together with all their children. During the day, they receive treatment and programs, so they get the same curriculum, or actually, it's a little bit more geared toward
the
perinatal element and the mothering and the parenting and all of that. Not that they don't get that here, because we obviously have a lot of parents here.
Yeah.
So they all live there, and they focus on their treatment during the day, and then in the evening, we have staff on shift 24/7, so there's always somebody there. And then in the evening, they're working on their parenting skills, like actually taking care of their children. But there's a staff person who's there, who's always going to be available if they feel like, okay, I'm reaching my end, or I'm being neglectful, because they don't know any different. A lot of them, sometimes they were just not raised in a home where somebody demonstrated, what it's like to be a good mom, and what does that look like. So that's really kind of how that works. And in order to qualify for Maple House, you either need to have children with you, or you have to be working toward reunification with your children.
Okay,
so it's very specifically focused on children and family. So
speaking of that, of that motivation, so that's something that is extrinsic. It's outside of you, but we try to have convert that. We want. I know they're telling you, the Children and Family Services are telling you need to do this, or we're going to keep your kids.
The stress of it.
But we try to with the curriculum, with the evidence-based curriculum that they have there, we try to show them you can be a good mother. You are a good person, and you this child needs you and deserves you. And so the motivation becomes something intrinsic, and so they can look at it. The Children and Family Services is not the foot on the neck, but as the support to get your child back. Because a lot of times, people are in denial, like that I really do something that bad to have them take my kids away. I don't think I really did, and they're telling me what to do. And so we try to tell them, though, but this is about you and your child, not about them. Jump through the hoops to get your child back.
What's the overall goal? What's your priority?
Yeah, exactly. It's about you and your child. And they get it. A lot of them get it. It changes. They have an excellent staff over there, I'll tell you. And
they deal with it every day. So they like you said, the experience is the mom might go through this over here, but they know how to deal with all those and still love them. Show them how do we find out what's going to help you get to that point.
Absolutely.
But like I said, if someone's saying, "Well, I don't think it was my fault," that reinforces they're okay. It's the system's bad. I'd assume that doesn't help their case.
It doesn't. So we have to get them to make them understand this is about you and what you want to do. Who you are, and not that someone has you here and made you come here. You know what I mean?
It's funny too, because we have a staff person right now who shared her story. I think you can find it on one of our blogs online, where she came because she was pregnant and she had one child that was in CFS custody, and she knew she needed to do that to get her child back, and so she came specifically just to get her kids back. That was it.
This is what I have to do.
So this one doesn't get taken, and she ended up going down to Maple House after she, I guess, had gone through, I don't remember all the exact details, and it ended up staying there, and she's been a staff person here now probably 8 to 10 years.
Wow.
So we have a couple of those kind of stories.
And how long is that program at Maple House, or is it when you do certain things then you're good?
Well, that can vary.
Especially with kids too.
Right, because they're dealing with a number of different factors. But as long as any client or resident meets what's called medical necessity, in other words, they are still benefiting from being in treatment, then they can stay with us. And we have multiple levels of treatment here. I won't go into a lot of technical detail, but it's 3.2, which is withdrawal management or detox. 3.1, which is I like to call sober living on steroids, right? So that's where you're in a controlled environment, you're in a safe environment, you're receiving some clinical services, some educational services, but you still have some flexibility to go out and look for a job, go out and look for a place.
Register for school maybe.
Take class. You could still do some things outside of the facility versus 3.5 level of treatment, which is treatment morning, noon, and night, and
You're just in here
evening,
to
and
you.
you're just here, and this is
Okay.
all you're focused on, and this is what you got to do, and that's determined based on, where you are on what's called
Yeah.
the ASAM. It's
The
an
ASAM,
assessment
yeah.
tool.
What
Yeah,
is
we have
that?
the American Society of Addiction Medicine
Okay.
assessment tool,
Okay.
and they have to be assessed every 30 days
Okay.
to see if they meet criteria or what level of care they meet criteria for.
Okay.
And so down here in Maple House, most of the time it's 3.5, which is
Okay.
the,
Yeah, the
the
higher
highest level
level.
of residential
Right.
treatment.
Okay.
And a lot of times, speaking about Maple House, a lot of times we can get a woman that's pregnant when you're talking about length of stay,
Yes.
and they can stay there full
Till
term,
they deliver.
Wow.
and then
Fantastic.
we can assess them, and they can still meet criteria for more treatment based on an assessment. And that she was focused on having the baby and
Transitioning
doctor
to-
visits and all
Right.
that kind of stuff, and she didn't really get a real
Good
chance
treatment
to
experience.
to learn
Yeah.
about treatment and be in treatment with her other child, those things. So the tool is there for that, and so that's why it varies. Even women who are need withdrawal management, unfortunately,
Yes.
that happens. They have medications where they can still just go straight to Maple House,
Wow.
and they will be on that medication for the safety of the child. They'll be on that medication for full term until they have
Till
the
they
child.
deliver.
Wow.
And so that's another factor that
The medical
for us,
necessity,
if we could get them in program as long as we could, we would. I mean,
Sure.
so we'll be assessing for those things to see where they're really at,
Yeah.
where they really are.
Well, at that point, you
know
don't
what I
want to
mean?
send them out too early, where all of a sudden then they relapse,
Yeah.
or then they have problems in the line. Then it just goes downhill from there.
Yeah, mind you,
Exactly.
there's no
Magic.
there's no magic time frame
time
for
frame
anyone's
isn't the issue. Yeah.
new perspective of self. Okay, a person can come here and stay here 6 months and really do really well, and they could die tomorrow. And the person can walk out of these doors after 2 days and say, I'm out of here, screw this place, and then come back and be one of our key speakers at our meetings after being clean 3 years. It's just a matter of at what point they develop a new perspective of self and have that self-love.
Is there any evidence-based, research or ways to tell someone's personality, background, anything? Can they be the person who's going to come back and speak in 3 years, or someone who after 6 months may?
Our experience will tell us a lot,
Yes.
but we've been wrong.
Yeah.
We've been wrong a ton of times, and so there's no one can tell you that.
We don't
You hear those percentages
Yeah.
about we have a 90%.
Success rate.
No one even knows those numbers. You know why they don't know those numbers? Because nobody comes back and say, "Hey, I'm using."
Hey, by the way.
Yeah.
And not everybody comes back and says, "Hey, I'm clean and I'm been clean for 5 years." Nobody does that, so you don't know.
When you mention so many variables in someone's life outside of the safe environment, how do you compare apples to apples? How do you know what may help them today may be detriment with them 3 months from now, 4 months from now?
Level of humility.
Yeah. How do you maintain that?
What their work ethic is with regards to, building a spiritual foundation. How engaged are they in recovery? See what motivates them to open their mouth in group. It's just to sound smart, or they're really asking questions because they really want to know, or they really want to help somebody else. Those are the kind of things we look for, and it's really to make it more simple. It's about level of humility. That's just my personal opinion.
And they'll be genuine. You can tell if they're being genuine or if they're being fake. Just to get the program done.
Sometimes.
We think we're pretty good at that.
Exactly. Experience.
Because actually it comes out in the behavior, Tony. It comes out in the behavior. They can be able to talk a good game in groups, and when Jamie's walking down the hallway,
Oh,
how you
everybody's
doing, man? Hey, how you? Because
Angels.
they know who she is.
Love Miss Lamb.
You know what I mean? They know who she is.
Yeah.
And then you can go out on the patio and they can be cussing up a storm and talking and telling war stories. You never know.
Right.
But those are the things that are red flags, and so
The application of, are you actually living what you say you're living?
yeah. So
Fun.
Yeah, I mean, talking a good game and, walking the walk. I mean, it's really all about how badly do you want this?
Yeah.
Really,
important is
anything, because, one of the things that will derail a recovery, because, I mean, we have people that'll come in. I just met a young lady not long ago that in our lobby telling me I was 12 years clean and sober, and here I am again. So, but one of the things that can derail recovery probably as quickly as anything, it isn't somebody going, hey, you want some? And it's right there in front of your face. It's that, like Michael said earlier, I got this. I got this. I'm 12 years in, I got this. And that deception, that deception of others. Let me just kind of, pull one over for right now because just that dealing within yourself, just like all of us, so hopefully there's some level of guilt that comes with that begins to eat at you, that now, you're really putting your recovery at jeopardy by telling these white lies or by falsifying this or by doing that. And so, we really try to create, if you're not going to be honest with other people, at least be honest with yourself, because that's going to derail you faster than anything.
Yeah, absolutely. I mean, that's where the arrogance comes in. Like, it's sometimes you'll see it, 911, I need help. 911, thank you for letting me in here. 911, oh, I'm so glad I'm here. 2 weeks later, oh, man, I got to go to group. So the level of urgency just drops, and you'll see that. So we try to encourage people, like, you need to keep your recovery at an urgent level. I mean, a 911 situation all the time. I heard somebody once say, be on guard for the unguarded moment, meaning that there's no such thing as an unguarded moment, right?
No, you don't know. You don't live in a
your
bubble.
guards up all the time, and that comes with humility once again, because what she's talking about, we've seen it. We've seen people stay clean, and that's exactly what I got it. Well, no, we're talking about life.
Yeah.
We're not just talking about substance use disorder. Apparently something happened way before. That's why she mentioned, like they handed me some dope and I just used. No, something happened way before, And so it's one of those things that they have to understand. This is a lifestyle that you have to live, and it is urgent, and you have to do this for the rest of your life.
Is it being humble enough to put all your walls down, mental, physical walls, and just go, hey, look, how do I start over? And like you mentioned, that sense of urgency to where I'm going to work on this. I'm going to feel this way all the way through the program.
Yeah.
I can't say I got it. That means my wall's up again, and I can't get anything in if my wall's up.
Absolutely. Like it's a self-centeredness that resurfaces. That's part of the addiction. Self-centeredness is if it's not any substance use, it's self-centeredness. If it's not wine, it's arrogance. You're addicted to those things, and you have to be able to see that. That's why the curriculum asks you about you. It doesn't ask you, what is the difference between this or that? They're asking you. Every question that the curriculum asks is you about you. It may have some literature about the topic, but then it asks you about you because it wants you to just honestly assess yourself so you can see the good and the bad.
What in your personality, what in your thinking process, what in your perception has made you this way, and the application of that is the addiction. Is that a kind of way to say it?
Well, okay, so here's the thing about that, is that we were talking about the mental illness and the unhealthy ways of managing life. We don't know what came first.
No.
But we do know that they feed off of one another.
Got it. Okay.
Right. So if I'm an addict and I need to keep using, and of course I'm going to keep the wall up. The people that want to help me, I don't want them to help me. The people that love me the most, I hurt the most, I don't want them to help me. So I have these walls up and I keep living this lifestyle because this lifestyle gets me my drugs, right?
Yeah.
It also gets me my comfort.
Okay.
You know what I mean? And so they feed off of one another. So if I stop using, I still have this addiction to all of this stuff here. I don't even know how to live life.
I haven't changed yet.
I haven't changed yet, you know. And that individual needs to be able to see that. They need to be able to see that. That's probably, there should be more of a focus on that.
Yeah.
You see that you stopped using like that. You know, you came in here and nobody else, and be aware of where you are. You have a bunch of people supporting you, a bunch of people trying to stop using, a bunch of people that have a structure there. Like they have a structure here. And they have to be aware of what's going on. You get up, you take care of hygiene, you eat at a certain time, you know, you groom and so forth and so on, and then you learn about yourself. But you learn, and they have to be aware that that's going on, and they have to kind of create that for themselves prior to exit.
Got it. So they have a structure.
They have create that situation. Like I need to go to another situation like this.
So they're having the structure of eating, grooming, your hygiene. That allows them, okay, that's your basis. Once it's taken care of, how do we work on you? But if that's thrown off every day, you're getting up certain times, you're getting up here, getting up late, early, eating this junk food or this food over here, then your body's under stress. How is your mind going to be less stressed or relaxed to be able to understand and be able to change?
Yeah, and they have to be, I don't think sometimes they're not aware initially of what that's giving them. What the structure is giving
They're
them.
naive. They just didn't know.
Well, we talk about the mental. I'm sorry, Jamie. We talk about the mental health part of it. You have to understand that kids are using at a younger age and more potent. There's spice. There's methamphetamine. There's all kinds of things that's going on, right?
That was never out there before.
So we're talking about just learning how to live. And being ill when they come to our facility at age 18, they may be had a mental illness for, like I told you, for like 10 years already or whatever it is, then they don't know about life. And so we have to center the treatment around what we believe they can achieve here, not just stop using substances. You know, we have to get them to a point where they can see the value of brushing your teeth and taking a bath and changing clothes every day and you know, being civil,
taking a step back.
Yeah, and so we have to center that treatment around that individual. If that's one of their main things, if we see that we may have missed something, and so we're going to go back and we're only going to have you work on this particular thing because we see that it's a struggle for you to focus on too many things. We need to do, and I mean that's client-centered care.
And when you do that, you have focus on one or two things and build them up from there. Does that give them the confidence and self-esteem that, hey, especially if they're younger, hey, I can do more.
You'd be
this
surprised.
Did well, I can do more. I can do one more thing, and then I can do one more thing.
You'd be surprised at how much it helps. The problem is sometimes focusing on other people. They need to continue to focus on self and what I've done here. Sometimes they look around and they see I'm behind. I'm behind.
How far so many others
people
are.
came. You know, I just need to keep looking at my achievement. I achieved this today. You know, so
that's great.
And likewise, you can't look at other people and go, I'm so much for. I mean,
Yeah.
For me, I liken all of this to my own personal spiritual walk, right?
Yes.
So, you know, we can't compare ourselves to each other. We have to just always be comparing ourselves with our best self and always trying to beat that. So whatever that is, and like Mike said, our staff accept that. Whatever your best self is, we're going to start there, and then we're going to try to take you just a little further and a little further. But, you know, kind of along the lines, too, of what Mike said, is we're trying to create something for them in here that they can take with them out there, which is why the expansion into continuum of care is so important because, you know, we know that there is a shortage out there. There is a shortage of places for women who, but I got my kids, where am I going to go? There's sober living houses for women, but I can't bring my children, so now what? Or even men, a lot of men who do not have any, they've got children they're caring for.
Yeah.
They need a place to go in a safe environment.
Would that help reduce the number of relapses also by having something that's more long term?
Absolutely. I mean, when you're sitting in treatment and you're nearing an end of treatment and you have no idea where you're going to go,
Yeah.
imagine the stress that puts on you versus I know there's a bed across the
Yeah.
street from me, or I know there's a house in Apple Valley that I can go and stay. And, and so not only does it relieve the pressure while you're in treatment, it also, when you get out, now, you don't have a job, you don't have resources. How am I going to feed myself? How am I going to everything? So now, you've got a little bit of added extra help to get you over that hump, and people guiding you through that process. Because while you're here, you're not doing much of that, because we have 3.1 level of care, but we don't have very many beds for that. We really focus on the acute treatment and working with the people that really need the treatment.
Well, then 3.1 is good for here. Great, you're assessed, ready to go. But the problem is, out there, that's a huge jump.
That's a big jump.
It's a big jump.
It's a big jump.
And we almost need, Jamie, another facility for 3.1
Hint.
level of
Just
care.
by itself,
Okay.
yeah. Sure,
and
I'll get working on that.
This is going to be this. You transition to this, transition to 1.0, which is outpatient or intensive outpatient, whatever
Intensive
that is.
outpatient, then outpatient.
It's that serious.
Yeah, it really is.
At the same time, we can give them the big picture. We can actually give them the big picture. We can't give it to them if we don't have those things in place for them, but we can actually give them the big picture,
Right.
because they have that self-fulfilling prophecy. When we talked about this fear of failure,
Of course.
okay, so I got a job, guys. I'm gonna be leaving in 2 weeks, but I have nowhere to live.
Right,
That other aspect of their stress is still not fulfilled.
exactly.
So while they're working on the self-image and seeing the good and that the good outweighs the bad, here we go. I got a job now, and you know what the thinking is? I ain't got nowhere to leave. Okay, I'm gonna go to work for 2 weeks. When I get this check,
That's it.
you think they're gonna buy
go
an
find my-
apartment or get a
Find my
motel
connect.
room? Well, they might get a motel room, but
Yeah,
you know what I mean. So they need support. They need support.
The next step.
all the way down the line.
And they experience that too, where you're with them. Hey, look, how'd it go this week? I did well, but this happened.
Yeah.
So you're still getting them transition to learn how to not cope, but actually understand how to deal with that in a real life setting. Not just, hey, this is going to happen to you. You're in it. How are we dealing with it? How's things going? What else do you need from me? What else can we help you with?
and we do have and make available an aftercare program. It's totally free of charge, and you don't have to be just a Cedar House graduate to attend it.
Okay.
You can be in recovery, having completed a treatment program, and you're welcome to come to the aftercare group.
But having a long-term care 3.05 allows them to be there, so there's more compliance versus, hey, there is a free aftercare service if you want to go.
Right.
So it makes it more
Right.
compliant.
Oh, yeah, no,
and
it's
obviously
different.
less
Right.
chances
Yes.
of going backwards.
Yeah,
Right.
it's if we could do those things, we're looking at funding, for those things, as opposed to possibly funding that would go to the Department of Corrections or
Yes.
you know what I mean. That money's going to go.
Funding's going to go somewhere.
It's going to go somewhere, and it would be nice to have this continuum of care that Jamie's speaking about, just to be able to care for them and have them know, from where it started, we're still here.
Yeah.
We're still here. We're just kind of having some kind of we're doing leadership now. We're Theory Z now. We're out here letting you just go ahead and do your thing now. But hey, we're here for you.
Still checking in.
It'll be just.
Well, and the funding would allow that foundation to build, so you don't get incarcerated. They're not at that stress state where that happens. Does that save the state long-term money?
Oh, there's no question. I think
Not even close, right?
I think there's been numerous reports that prove what it costs to house somebody for a
day.
year
Yeah.
in state prison.
And making them, not make them, but when they're able to get a job and support themselves, support their families, how's that help them get off of the state funding and then support themselves and be an example for their kids, their family, and become part of that society?
Not to mention all the other families that the traumas caused by that person participating in crime and
Sure.
court costs and
Second,
probation
third
and all that kind of stuff. I mean,
perimeters, yeah.
I think that's for another.
Yeah, it's a whole nother
Tony.
podcast.
I'm on the politics.
But I mean, there's two sides to it. One is just the practicality of the finances that are associated with it. The other is it's just the right thing to do. Whether it saves money, costs money, whatever, it's the right thing to do. But the fact that it can save money and it can mean now they're supporting their community instead of taking from their community, and they're not hurting other people, and it actually is the right thing to do. I mean, there's just it's a no-lose situation when you make these types of programs available and accessible. And we are nonprofit, so we do receive donations for tax-deductible receipts. Hint, hint. We have a gala coming up. We have a golf tournament next week. What else, Mike?
I don't know what other fundraisers
We're going to be having some events up in the high desert, focusing on that Tay youth. Because boy, that's a population that is
what's a
right.
Tay youth?
Tay stands for transitional aged youth, and these are 18 to 25-year-olds. So legally, they're adults,
yes,
right? But at 18, were you ready? I wasn't ready.
No, I'm going to say no.
And so yes, many of them are former foster youth that when they were 18 were almost kind of like forced into homelessness because now the foster care system is no longer accessible to them for whatever reason. So now they're just living on the streets and they have nowhere to go. But this is a group, in my estimation, Tony, that has the chance for an upwardly mobile trajectory, probably more than any other, because they're 18 and they're 19 and they're 22 and they got their whole lives ahead of them.
Potential.
And the potential, I mean, and our partner says this all the time. The next Mark Zuckerberg could be in this house right now. He just happened to need an extra helping hand to get through a year or so to help him find his way, And so that's a population that, I've worked in foster care for a very long time, so it's very near and dear to my heart, number one, but also I think really has a lot of potential to, long-term to produce some real outcomes. So.
And how does that center work up there? Do they get them into a school setting, a work setting, or what? How do they promote? Is that a bed setting too?
It is. It's a residential program,
okay.
And they can come referred through 2 referring agencies.
Okay.
And what happens is, in order to qualify to come to Oasis House, which is the name of the program, you have to first of all be homeless. Which is
in Apple Valley.
They are in Apple Valley. Well, they don't have to be homeless in Apple Valley. That's just where they have to be willing to go if they want to live. But also, they have to be willing to commit to be working toward either education, looking for a job, saving money for an apartment, a car, whatever it is. We want to make sure that nobody comes to Oasis House thinking that they're just going to hang out and play video games all day.
Yeah.
That's not what Oasis House is. You have to be actively pursuing a better life for yourself, one way or another. But you do that with the support of our partner agencies and with our staff, kind of pushing you in the right direction, right? Connecting you to resources.
Schools.
Exactly. We're right down the street from the local college up there.
Nice.
So, a number of our kids are students at the local college. And I mean, it's amazing how many kids, young adults.
Yeah, we call them kids because I'm old.
Yeah. So you're old, right?
I'm old.
But the reality is there are students that come into class every day, having brought their homework, having their backpacks, that are sleeping in their cars. And I mean, they're showering at the gym, and they're going wherever they can to get something to eat for the day. But they're staying focused because they want to be in school. So, because they know if I don't do something, 5 years from now, I'm still going to be 5 years older, but I'm going to have nothing else to stand on.
This is my chance.
This is it. So, so those are kind of the kids that, or like I said, we saw a number of kids graduate from Cedar House that we knew had nowhere to go. And they were, and so the county's doing what it can, the state does what it can, I mean, there's so many social programs out there, but they can only do so much. So, yeah.
You
So
have to meet
we're-
them on a halfway.
Yeah, exactly. So we're there to help be that support for them.
Right.
So,
Right. You guys really explain the whole program, how it works. And I like how it comes from a loving position. How do you help everybody? How do you meet wherever they are, build that trust with them, let them know I'm here for you to break down their arrogance, break down their walls so they can see, well, who am I causing this addiction or this problem I'm having, and then get myself back into a normal, whatever normal is, be able to handle the stresses of life, of working, of family, of kids, of paying my bills, whatever it might be. Cool. Anything else for your first show here?
Well, welcome to Cedar House.
yeah.
Thank you. Yeah,
Yeah,
you guys
welcome
explained
to Cedar
everything. I mean, it's like I said, a Christian-based program to
It
help.
actually is not. I'm
It's not,
sorry.
sorry.
I need
Yeah.
It's a Christian
spiritually
based. I
Yeah,
use that word.
yeah,
But
yeah.
spiritually based program is where it helps you understand that we're not controlled.
Right.
How do we first get that? Like you mentioned, Mike. Then from there, build on top of that, and let everything else fall to the wayside and give it time to heal. Not as humans do, as I do, force things which almost makes it harder to heal.
Right.
And you're helping any age after 18,
Correct.
women with kids, fathers with kids, young adults, everything.
Well, we don't have a place. We don't have a treatment facility for
Okay.
the men
For the men, yeah. But
with
here,
children.
yeah.
But yeah, so that's like
Right.
Mike. I mean, there's so many areas
The
that
vision
we
of-
could
Yeah, there's so
expand,
many-
and we
there's so
do
much.
have vision. But right now, we kind of got our hands full. We're busy.
You guys are doing well.
Yeah, we're
You went
trying
from
to-
how many beds initially 45 years ago to where you are now?
Yeah, well,
It's huge.
yeah, the only thing we've added in the last couple of years has been the house up in Apple Valley.
Okay.
But one of the things that we're really focused on right now is in order to provide a better quality of care for our clients, is to have more staff available because the paperwork is what
Yes.
it is,
Fun times.
but it has to be done. We want to make sure that, our caseloads and our staffing ratios are such that the clients don't suffer because of all this extra paperwork.
Yeah.
So that's what we're focused on now, and so we have plans to put a 10,000 square foot building
Wow.
adjacent to this one. I mean, it's the goal, it's the vision, it's the dream, just so we can have room for staff, because right now, we've converted just about every broom closet in the building into
Yeah.
an office that we can. So we're desperately in need of more space for staff, and that's kind of our focus right now.
But if someone's gone through the program and they like what they see and they want to transition as being a staff for the program, do they have a less chance of relapsing when they become a staff?
That's a good question.
That is a good
but
question, but-
we've
Because you have all the training.
I-
You're
I
going
would-
through it
I
every
would-
day.
I would say the numbers speak for themselves. So the answer is yes. There's a better chance to stay clean and sober, because most of our staff that went through program here, they come back and work here, and I would say a good 90% maybe of them are here and they're clean and sober.
Well, you're around the
You know?
environment that got you better.
Exactly.
Yeah.
At that point, you're in the training that keeps you better. Now you understand the back end of the training. It's just the paperwork. If you have the passion for it, if you actually have the passion for it and compassion for it.
One thing I would like to add,
Yes.
when Jamie's talking about staff and being engaged, because that's what's going to happen. Staff will be more engaged. The more staff we have, the less clients per staff, per case manager. But also, all of our staff are engaged in client care. Everybody.
okay.
When we walk through the facility, how you're doing, even if you're not in treatment. And one of the places where the clients can come back and volunteer is in our kitchen with our kitchen staff.
Okay.
All of the kitchen staff are recovering addicts. They speak to the clients about recovery all day long. It's amazing,
Yeah.
And while they're here, they speak to them about recovery. And so they remember that, and that they want to come back and volunteer in the kitchen. Or some of them all of them work in the kitchen now. All of the working staff in the kitchen were clients here.
So even the kitchen volunteer staff, I mean, in a common sense thing, they're going to have a less chance of relapse.
Absolutely.
Absolutely,
And they come
yes.
here for that.
For that
Awesome.
purpose,
They
they
come
want
here
to
for
be
that
around it.
purpose. and it's been great. It's been great to see the relationships get built, and and they can also share with the other clients and say, I was here, and so it's a really good thing.
And when they help someone else out, it reinforces them what they're doing.
Well, and that's that's one of the pillars of the 12 steps is you have to give it away in order to keep it. So we have one staff person that comes to mind that works here, and her name is Melody, and she does the laundry. She does the client laundry and the house laundry. That is her full-time job, and she's been doing that 10 years. Since she graduated, she came back as a volunteer.
Wow.
She got hired on, and she absolutely loves her job. And it's not because she loves doing laundry.
Yeah.
I'm sure.
Yeah. She loves the client.
She loves being with the women because she always gets a couple of women in program to help her and to volunteer in her department. But and I remember when I first toured, when I was interviewing for this position, I walked down the hall and there were these bags of clothes sitting on the floor, and they had this big piece of paper with 2 initials, and I was like, what is this? And they're like, oh, that we do client laundry here. So every room has a day of the week that they bag their laundry up and they put it in the hallway. Dirty laundry. Melody and her team come through and pick everything up, take it to the laundry room, clean, dry, fold. Okay, they don't just throw it all back in a fluff and fold, nice and neat, and puts it in a clean bag and sets it on the floor. So when clients are out of treatment for the day, they find their bag on the floor and they pick it up, and there's their laundry. And that is her job, and she does that all day, every day, and loves it because she has this wall in the laundry room that we used to give certificates of appreciation when people were graduating. They do, but I guess it just got to be so much they stopped that process before I got here. But Melody has her whole wall is covered with them from clients that were leaving, just thanking her for her heart that she's poured into them and for doing their laundry for 90 days. Right?
Yeah, that's the other part of her is that she's always in the hallway talking recovery to the client, talking spirituality to the clients.
Always.
Sometimes she volunteers to take them.
She picks them up, takes them to church
or meetings. I mean, she's
phenomenal
all day long. And it's like you said, when you're walking down the hallway, you'll see her actually talking to the clients about recovery. She'll stop and talk to them and pray for them, whatever they want, whatever they need. She's fully engaged. She's fully engaged.
Terrific, yeah.
So it's
that's
really great.
just an example of the staff.
Well, then you get that ambiance everywhere. How do you? There's nowhere to not to hide, but you're going to get the love from everyone on the staff.
Yes.
Volunteers, staff, laundry, eating, whatever you do, unless you're sleeping unconscious, you're going to have some type of love around you.
Yeah.
Even then, our night staff go around and check.
That's great.
It doesn't matter what kind of love it is, because sometimes it's tough. But we care enough. If we don't say nothing, that means we don't care. So we care enough to call you.
There's no one to hide with, because they're not going to give you that good or tough love or make you feel like there's something going on.
Right.
Well, that's a great story.
Thank you. I don't know if that means anything, but
no, I mean a lot of it is too. You guys do a good.
I meant on your camera.
Oh yeah, it's low power, but they'll figure that out later.
Okay.
We're about to wrap up. Anything else to add?
No. We welcome
thanks
the
for having
opportunity
us.
to come back, but thank you. Yeah, this has been a terrific opportunity.
People don't, I think, understand, and because we live in our little bubble sometimes, how much addiction affects, and even mental illness too, not only you, but also people around you. And even people 3-4 deep around you.
Absolutely.
So when you can find somewhere safe that gives you that chance to get not only clean, but also understand why you're doing something that doesn't work for you physically or mentally or people around you, that's more important. That's and again, I'm not here, but I still work on myself every day. How do I keep myself spiritually set, my goals, my life, and let the stressors around me not affect me to cause something to happen to me or my family or whatever, or people around me too. Right. So how do we all
personal responsibility for that?
This is a facility, but we all need, I think, that ability to understand what's it take us to understand. Hey, there's something else out there we can't control. how do I give to be an example of who I am and whatever I do.
Well said.
That's what I get out of it.
Yeah.
That's my day.
Okay.
Well, thanks for being part of the Crooked Spine Show. This will be on YouTube. I'm going to put all the links on my Crooked Spine Show Facebook page, YouTube, everywhere else I put stuff on. Your house and how the internet works, obviously, and your foundation, your events.
Excellent.
Thank you, Jamie.
Thank you, Tony.
Thank you,
Appreciate
Mike.
it.
Thank you, Tony, for having me.
Yeah.
Thank you. It was fun. Good luck with
Yeah,
your
that
local
was fun.
teams and good luck with our Steelers.
Yeah. Thank you. Yes.
That's the plan.
That was
right?
terrible.
That's the plan.
Great.